If you're considering plastic surgery and you're worried about the most common complications, then these are the three that we always consider as plastic surgeons. Number one, anesthesia. And that may not be going to sleep. Sometimes that's just awake, local anesthesia. We really have to calculate that based on your unique weight. So anesthesia. What's our second most common complication that we worry about? Infection. You'll see a lot of plastic surgeons, myself included, give patients antibiotics. We don't want our patients to have infections, and that's you included. So antibiotics are really the second thing that we try to do to prevent infections. And number three, bleeding. And this is a little bit of a twofold thing. So bleeding can be blood loss, but it can also be clotting. And so we are constantly going to be looking for any clotting disorders in our patients, making sure our patients are up out of bed so they don't get a deep vein thrombosis or a blood clot in their legs. What that means is that a blood clot that can start in your leg and work its way up to your chest, and that can actually be deadly. So I'm always going to be preparing for that and making sure that we can decrease that risk in any way we possibly can. And also during surgery and right after surgery, making sure that your risk of bleeding is low, whether that be making sure that there's no active bleeding during your case, making sure there's no blood collections when we see you in your post-op appointment. Any of those things kind of count into that. So really it's three, but it's sort of four.